There's no question this past year has been hard on Canadians. But during Black History Month, conversations about what's being called a twin pandemic have been reignited.
Black Lives Matter!
As people across North America took a stand against systemic racism in the summer of 2020, it brought collective emotional trauma for Black Canadians. At the same time, data proved what many feared. If you're Black, you're at greater risk of being impacted by the new coronavirus.
Fortunately, was hearing a lot of the devastations that were brought from COVID-19 and a lot of the community members that we were losing. And then at the same time, a lot of people losing their jobs.
The president of the African Canadian Civic Engagement Council continues to hear from members of her community about the trauma of COVID-19 and racism. She'll be resending their research on COVID-19 and Black Canadians to all levels of government this week.
You're 3 times more likely to contract COVID-19 if you're a Black Canadian. One of the reasons, you have more people working outside of the home, you have larger households.
Socioeconomic factors like being more likely to have a public-facing job or taking public transit are factors in Black Canadians' exposure to the virus. But when the survey was released this summer, most provinces and health authorities were not collecting race-based data. In places that were, like Toronto, the findings were similar.
Now this is happening in Canada. So a lot of people were pretty scared. And I mean, it was some of our worst nightmare come true. However, we still don't see a significant policy change from government.
We learned Alberta started collecting race-based data in late November, when Premier Kenney's issues manager tweeted some of it out in defense of comments many felt were blaming South Asian cultures for the spread of the virus. That data is still not public. Alberta Health telling City News they are, quote, working to collect and analyze self-reported data on race, ethnicity, and socioeconomic status. This work is still underway.
From a public policy perspective, you need to focus on, the communities that are at highest risk. And what are you doing about that?
Programs that cater to communities like the Black community right now that is going through alarming rates of collective trauma.
Hoping more information on how different communities are impacted by COVID-19 will be made public to help shape the next steps and build trust around the process. In Edmonton, Carly Robinson, City News.